What's up, everybody? I'm Ronnette Rollins from Praise 104.1, and I want to welcome you to our Heart to Heart Women's Health Virtual Town Hall. We are at the end of March, Women's History Month, and what better way to end the month than to talk about our health, right, ladies? So today, I'm really excited to be talking with Dr. G. What's up, Dr. G?
Hey, what's up, Ronnette? Thank you for having me.
Thank you so much for taking time out of your busy schedule to come talk to me and our audience. So, let me tell you guys just a little bit about Dr. G. Hold on, I got to put on my readers. So, Dr. Nordine Galgal, he likes to be called Dr. G. He earned his professional credentials at some of the most prestigious institutions with high honors and distinction. His undergrad and postgraduate work was accomplished at the following university hospitals. For his internship, internal medicine at George Washington University Medical Center in Washington, D.C., his residency with diagnostic imaging at Georgetown University Medical Center, Washington, D.C., fellowship, vascular and interventional image guided minimally invasive procedures at Georgetown University Medical Center and the Washington Hospital Center. They have a special place in my heart. Professional practice and recently held appointments at the MedStar Southern Maryland Hospital Center, chairman of the Department of Diagnostic Imaging, chief vascular and interventional radiology services, member of the Medical Executive Committee, chairman of the Education Committee, chief of hospital-based physicians, member of the Nominations Committee, a member of the Utilization Review Committee, member of Radiation Safety Committee, member of the Cancer Committee and Tumor Board, and Radiation Safety Officer. Woo! You got it going on, Dr. G.
Oh, thank you. Thank you.
So we want to talk about, for us ladies and
Mhm.
our lady parts, right? And making
Yeah.
sure we keep them healthy. And
Correct.
for those ladies that may want to become mothers in the future, they have to go through a series of
Uh,
testing. And sometimes things pop up like uterine fibroids that may make that a little bit difficult where they will have to address that before continuing on
mm,
with pregnancy plans, right?
correct.
All right, so let's start with uterine fibroids. Can you break down for our audience what are uterine fibroids and how common are they?
So, uterine fibroids are benign tumors. They just arise from the smooth muscle in the uterus. They're not cancerous at all, and they never turn into cancer, despite the information you may hear out there. They're very common, actually. Statistically speaking, up to 80% of women may have a fibroid during their lifetime. But fortunately, we don't have to, treat everybody with fibroids. We only basically treat the patients who do have actual symptoms.
Hmm.
And those are usually around 25 to 30% of the actual population. So definitely they are very common and they can, cause a huge impact on quality of life.
Hmm.
But again, like I said, unfortunately we have a lot of treatment options these days, especially with the advances in technology.
Okay, so before we get into the treatment options, I noticed you said some of the uterine fibroids
Mhm.
you actually remove, but some you kind of leave there. Can you tell us what makes the distinction between whether it needs to be removed or not?
Yeah. So first of all, um, not everybody is going to require treatment, even if they
Hmm.
do have fibroids. So the rule I go by is you have to have symptoms. If you don't have any symptoms and you incidentally were found to have fibroids, there's no need to be treated because the risks of the treatments outweigh the benefits, from getting rid of the fibroids. So really, the most important element is you've ever been diagnosed with fibroids during an ultrasound, during some physical examination, but you do not have the usual symptoms we see with fibroids, do not do anything. If for on the other hand you do have symptoms, there are symptoms, and that interferes with the quality of life, then based on age, the number, the size, and the actual situation specific to every patient, we can offer different treatment options.
Okay, so let's dig into the symptoms. You said if the symptoms impact your quality of life. So, what are some of the most known symptoms for
Mhm.
uterine fibroids? What makes you say, okay, I need to go to the doctor? What
Right.
should we be looking for?
Yeah. Most of in the majority of cases, patients will have an abnormal cycle. They will have like heavy periods, periods that linger for like 5, 6, 7, 8, 10 days. Sometimes I've seen patients bleed between periods. So
Mm-hmm.
heavy bleeding, which in medical terms is called menorrhagia, but basically what it is just when your cycle is too long and too heavy. With
Okay.
that comes also cramping, a lot of cramping. And the cramping can happen during the periods or it can happen also between periods. Sometimes the fibroids grow to a certain size where they do affect other functions like frequent urination, like constipation, the bloating, the heartburn, a lot of other things that result from the compression of the surrounding organs.
Mm,
Sometimes patients do have back pain and they keep being treated for back pain for years, only to find out later that there was
that
nothing
is a
wrong with those
fibroid.
signs.
Oh my goodness.
The fibroid, yeah. Sometimes the pain can even irradiate down the legs, can go down the legs, and then next thing you know, because of the pressure within the pelvis, we have varicose veins and all that, and we end up being treated for varicose veins, while in fact the issue is mainly in the pelvis around the uterus. So the symptoms sometimes may not look that they're related to each other.
Mm,
So here, back pain and heavy bleeding, don't go together, for example. Frequent urination and heartburn, things like that. So when you have this, bunch of symptoms that don't correlate together, you have to think that there may be something that's causing compression or mass effect inside the pelvis. And most likely that's going to end up being related to the uterus, mainly fibroids, because they're that common.
wow. You
Yeah.
are blowing my mind right now. I had to like remind myself, close my mouth because I was like, what?
It's
That is a lot of great information. Thank you so much. Now we have a question from the audience, and
mhm.
thank you guys so much for tuning in. If you could do me a huge favor, because I know other ladies need to hear this information too. If you can like and share from wherever you're watching, whether it's Facebook or on YouTube, please, please, please share this. Okay, now we have a question from the audience. CM wants to know, does endometriosis cause or increase your chances of developing uterine fibroids? That's a great question. Thank you, CM.
Thank you, Sam, for the question. That's a really good question. Endometriosis, just so it's not confused with adenomyosis, which is basically thickening of the lining of the
Okay.
uterus. But there's no study that shows that there's a relationship between endometriosis and fibroids. But most of the time, what happens if you do have symptoms related to endometriosis or to adenomyosis, which is thickening of the lining, possibly the patient could also have fibroids in addition to that. But the risk factors for fibroids, we don't know really much about that, but it's genetic. It tends to run in families. And one thing that I've noticed from my practice that helps a lot is obesity tends to be a really important risk factor that is most of the time overlooked. Patients, when they lose weight, their symptoms do improve, and I've seen that time and again. But endometriosis by itself does not cause fibroids, but can coexist with the fibroids.
Mhm.
And adenomyosis, also, which is a thickening of the lining, does not cause fibroids, but can coexist with the fibroids.
Okay. Thank you so much for that. And thank you for your question, CM. All right. We've got another question from the audience. Miss Gina White wants to know if the fibroid, oh, this is a good one. If the fibroid is removed, does it grow back? That's a good one. Thank you, Gina, for your question.
That's a very good question, Gina. Thank you. When fibroids are removed, usually they won't come back. But because patients who develop fibroids are prone to having them, you know, and prone to having them also in the future, most of the time they end up not having just a single fibroids. I mean, fibroids can go from 1 millimeters to a size of, watermelon, basically. So
Okay.
you go for an ultrasound or you go for a test and it shows you have two fibroids, but probably you have tiny ones hiding inside the uterus that are not picked up with those testing that we have today, the technology we have today. But you wait a couple more years and those fibers will show up. So
Wow.
removing a single fiber or just one or two fibers that not prevent the other ones that are hiding in the uterus from showing up in the future. Also, it depends on the type of treatment you're getting for the removal. Are we talking about myomectomy, which is the traditional surgical removal? Are we talking about embolization? Are we talking about hysterectomy? That also can influence the risk of fibroids, coming back.
Returning.
So
Okay.
there are treatment options that are definitive and permanent in nature, and there are treatment options that are temporary, sort of a band-aid until you figure out a much more permanent treatment option.
Wow. Okay. Um, Woo, y'all, my mind is blown right now. I love this information. Listen, those who are watching and listening in, if you have questions, please do not hesitate to
Absolutely.
write them in the chat so we can talk about it. I mean, we've got a doctor who is certified, honey, in doing this, knows about our bodies and what goes on. So let's take advantage of this right now. All right. Patricia Long, she wants to know, is it dangerous? Let's
Mhm,
see. Is it dangerous to not get your
mhm,
fibroids treated if you're not
mhm.
experiencing bad symptoms?
Okay. So there's a big difference between not experiencing bad symptoms and not experiencing symptoms at all. So if you're not experiencing symptoms at all, there's no need to do any kind of treatment because you're just be going to be exposing yourself to
Okay.
extra treatment for nothing.
Okay.
Because fibroids by themselves are not dangerous and they don't turn into cancer and they're not life threatening.
Okay.
But when they grow in size or they grow in number or their location, they may cause symptoms that can actually make the patient miserable. So we want to stop that from happening. So if you don't have symptoms, don't do anything about it. But if you do have symptoms, regardless of how serious or severe the symptoms are, it doesn't matter if it's very heavy bleeding or just a long cycle. It doesn't matter if it's just a little bit of pain or if it's a lot of pain. If there are symptoms, seek help. It's extremely important because that's an early sign that it's only going to get worse as you go.
Ooh, okay.
Mhm.
Thank you so much, Patricia, for your question, and thank you for your answer, Dr. G. Now, here's another question
Mhm.
for for those who may think that they do have fibroids or they're curious
Mhm.
about it and want to talk to their doctor.
Mhm.
Which doctor do they go see? How do they go about asking for help specifically for
Mhm.
fibroids? And for us women of color,
Right.
sometimes we have to ask
Correct.
for specific things because
Uh,
otherwise we won't get it. You understand what
right.
I'm saying?
Right. Right.
Okay.
Yeah. Uh, now, like, it's true that fibroids are, more common in, African American, more women compared to other ethnicities. But also, what I like about it is that African American women tend to be more educated about fibroids than, other ethnic backgrounds. That said, if you do have, like I said earlier, symptoms sometimes may not make sense together.
Right.
Back pain and urinary frequency, heartburn and constipation, something like that. So talk to your primary care physician. They will
Okay.
probably try and put two and two together and come up with an idea of what could be causing the problems, because we can't assume it's just fibroids versus something else. So we have to get to the bottom of what's causing the symptoms. And most of the time, if the symptoms are pelvic related or
Mm-hmm.
related to the uterus, and the
Mm-hmm.
physician will figure that out and they will ask for an ultrasound. Once you do the ultrasound, which is a cheap and a quick way of figuring out what's going on,
Mm-hmm.
but it's not a tool to decide on future treatment. That's
Okay.
I wouldn't go by ultrasound to design a treatment plan for a patient. So that's when it becomes important. Once you realize that your symptoms probably are related to the uterus or to the fibroids or the adenomas or any of those conditions, then you need to figure out which specialist to go to. Obviously, you can talk to your gynecologist because gynecologists do deal with these kind of issues, but they tend mainly towards traditional surgery, which is the hysterectomy and the myomectomy. There's another subset of physicians which are called the interventional radiologists.
Mm-hmm.
Interventional radiologists, they do what the traditional surgery would do, but with minimally invasive equipment, minimally invasive technology. You can look at it like the smartphone of surgeries, basically.
Okay. All
that's
right.
how, that's how I like to look at it. Like
Mm-hmm.
smart technology for these treatments. So because of the impact of all these conditions on the healthcare system, on the patients, on the health, society, we
Mm-hmm.
like to proceed from minimally invasive to more aggressive treatment, based
Right.
on the situation. But always talk to your primary care physician. You can talk to your gynecologist, but if you're sure that you do have fibroids, or you do have thickening of the lining, or you do have some endometriosis, you can talk to the interventional radiologist. Just Google fibroid specialists or interventional
Okay.
radiologists, and there are so many people that are very competent and they can take care of the patient.
Okay. But start off with the primary care physician
Yeah,
and
talk to
and
your
go
primary
from
care so
there.
they can direct you.
Okay.
But I want to emphasize one thing. Is because of what's been happening in the pandemic and all that. Patients also need to be advocate for themselves. So
Yes.
do your own research, look up things, get 1, 2, or 3 opinions. Don't be shy about it. Ask questions. Always ask questions and ask about your options.
Yes.
Never just take one option and run with it. Always
Mm-hmm.
ask about what kind of options are there, from minimally invasive to more invasive, and then talk to several doctors, before
Mm-hmm.
you come up with a treatment plan. And you'll find out that when you do your due diligence and your research, you tend to make a good decision for yourself.
Yeah.
Yeah.
Yeah, thank you for that added piece of information. Brian, keep this question up, please. For those who are just joining us, first of all, thank you so much. You are tuned in to our Heart to Heart Women's Health Virtual Town Hall. I'm Ronnette Rollins from Praise 104.1, and I have the pleasure of speaking with Dr. G. Now, let me tell you about Dr. G. He likes to be called Dr. G. It's Dr. Galgal. He's a highly trained, board certified physician who specializes in diagnostic imaging, vascular medicine, and image guided interventions. He is licensed to practice medicine and surgery in Virginia, Maryland, and DC, or the DMV, as we like to call it. He has over 20 years of experience in his field, specializing in minimally invasive image guided surgical procedures, what he addressed to as the cell phone kind of thing, the quick of it. He is held in the highest esteem by his peers and is regarded as highly skilled at image guided diagnostic and therapeutic procedures. He's performed thousands of minimally invasive and complex procedures of the entire body without any major complications. So that's the kind of talent and skill and intelligence
Thank
that we're
you, Ned.
talking to tonight with Dr. G.
I'm gonna
Now,
blush.
now, Gwen Murphy, this is my two-step partner from the Praise Power Mix. First of all, hey girl, what's up? Thank you for joining us. And y'all, please do share this. We know that other women need to hear this information, so
Absolutely.
make sure you all share this. Okay. Gwen wants to know, Dr. G,
Mhm.
what do you recommend for women between perimenopause and menopause with severe cramps? Oh, child, I want to know too. Help us, sir. What can we
So
do?
it's a very good question. Cramps can actually be a serious sign, that something is going on with the uterus, whether fibroids or something else. Especially if it's combined with bleeding, then it definitely needs to be investigated. But cramps also can be functional in nature. So if you have cramps and those cramps don't go away, they linger, they get worse over time, they are accompanied by other symptoms. Do you have weight loss? Do you have fever? Do you have any discharge? Things like that. Then it's better to have it investigated. And again, a trip to the primary care physician, ask questions, be advocate for yourself, get an ultrasound. And then basically, once you get the ultrasound, you should have a sense of what's going on. Is this something that needs further evaluation, or is this something that can be, treated conservatively? So in the perimenopausal area, you'll see a variety of symptoms that sometimes are not really don't mean specific pathology. But
Okay.
like I said, time is of the essence. If this is a symptom that is lingering, that is not going away, or comes with other symptoms, is accompanied by other issues, it's always a good idea to have it checked.
Okay. So
Yeah.
now I want to add one more thing. Ladies, Dr. G has encouraged us to be our own advocate at the doctor. And one great way to start is to make sure that you are paying attention to your cycle and what happens during your cycle. Do you cramp beforehand? Do you cramp during? Like having all of that. And y'all know, like you said, with technology, there's an app for that. You can always put that information in your phone so that you can recognize when the changes happen. So I'm going to be transparent. Y'all know that's the only way I know how to be. Baby, I hit these 40s, honey, and this body got to changing. The weight started going, and no matter how much I was working out, I mean, working out just wasn't working. And I love me some food. So I just tried to, tailor how I eat and try not to eat so crazy. But I noticed the changes because I was keeping track of them, in the app and all that other kind of stuff. And also keeping very close contact with my doctor, going for my yearly checkups, going for that mammogram, even though they squeeze our, glory and honor, child, but it's for our good. So ladies, make sure that you're keeping track of your symptoms so that you know when they change. Okay. B White wants to know, are there any preventative measures? Oh, thank you. Preventative measures we can take to prevent fibroids.
So you're not gonna find, anything in the literature like that would tell you how to prevent fibroids. Like I said earlier, I mentioned this could be genetic in nature since we see that it runs in families. But certain measures that can actually be very good for your overall health tend to help. So if you're overweight or obese, try to lose some weight. If you're sedentary, try to do some exercise and all that. If you're taking any specific medications or supplements, talk to your doctor about that because they could be causing you symptoms. So anything that could prevent the fibroids, unfortunately, we haven't gotten there yet. But
Okay.
I've noticed from my practice that weight loss plays an extremely important role.
I see you keep harping back on this weight loss thing. Didn't I just tell you I was having issues with the weight loss, Dr. G? It's tough for us ladies, okay? Listen.
Not that one.
So I want to get to this because it's very important. You tapped on this towards the beginning of the interview when you talked about fibroids and the treatment of it, that a lot of places or a lot of doctors, the first thing they go to is a hysterectomy. So with there being many treatment options, why is hysterectomy always the go-to? Why is that?
Yeah, unfortunately, we've seen that. There was even a big article that came out in the Lancet, which is one of the most respected medical journals, in 2017, and they looked at all the hysterectomies that are done, across so many countries, but especially in the United States, almost 650,000 hysterectomies every year.
Wow.
But what was more bothersome in the article is that they found out that 75% of those hysterectomies were unnecessary.
What?
Yeah, and if you look at, why do patients most of the time get hysterectomy, it's because of fibroids. Now, fibroids are benign tumors. So hysterectomy does have its place in the treatment arsenal against fibroids. But like any other procedure, it should not be the first thing, the first option, because it's pretty invasive. It's pretty, invasive. But unfortunately, this is all mainstream teaching, 40, 50 years ago. That's all we had available. Either you do the hysterectomy or you had to deal with your symptoms. But with the technology advances, we should not be offering our patients hysterectomy as the first option. And patients, like I said, and you mentioned it, is be advocate for yourself. If you're offered hysterectomy as the only option, hey, what other options are there for me? Is there anything that can avoid me a major surgery? And then that because the patient needs to stay in control. You need to stay in control and decide when to have the hysterectomy if you need one. don't take it as the default, option, basically.
Mm-hmm.
So there's also an issue with education, both in for healthcare professionals and for patients,
Mm-hmm.
because it's been the most common procedure performed for fibroids for a long time.
Mm-hmm.
Almost as if, like, oh, each time you think about fibroids or you think about the symptom, you think hysterectomy will take care of it.
Mm-hmm.
But with the advances, we realize that those heavy surgeries don't come without a cost, both in terms of, physical cost, financial cost, clinical cost, so many things. But if you decide that you need treatment, or your physician decides that you need treatment,
Mm-hmm.
then ask about all the options. Even if your physician tells you, I think the only option for you is this, you say, okay, what other options are there for this fibroid? We have the internet, we have second opinions.
Mm-hmm.
And, once you gather enough information, you will start to see clear into the issue. And honestly, personally, I think the only patients that do need hysterectomy are patients with malignancy, with cancer. Mm.
Okay.
Now, for
Okay.
fibroid patients, the only time we would, offer them hysterectomy is if we have exhausted every single other option out there and we still don't have control over the symptoms. And that is extremely, exceedingly rare. I've never seen that, basically. We've always had
Okay.
really good success with deembolization. So the treatment options can range from conservative management to medication to conventional surgery to embolization to radio frequency. I mean, so many things available to patients. Ask,
Mm-hmm.
ask questions. Don't be shy.
Okay.
Mhm.
I love that. So ladies, if you're missing everything, let this stick, okay? Ask questions and get second opinions, second, third, fourth opinions. Ask Google, ask, all ask Siri, do all your research, okay?
Yeah.
Also, if you guys have questions, please do put them in the comment section. So we have one from Sherlina Morgan. I hope I'm saying that right, Sherlina. She asks, she's been told that certain foods,
Mhm.
chicken, causes fibroid growth. Is that true? Or any other foods
Mhm.
cause fibroids to grow?
Mhm. Actually, there's no evidence that any kind of food has any causal relationship, with fibroids or
Okay.
any pathology in the uterus for that matter. The theory behind it in terms of diet and foods is that some of the foods may contain estrogen. Some plants can contain estrogen. Some supplements may have estrogen on them. Some medications have estrogen, red
Okay.
meat and all that. And that potentially could, affect the uterus and affect the fibroids if you do have them already. But you have to eat a huge amount.
I was going to say, so it's basically portions,
Yeah,
the
yeah, you have
portion
to
sizes.
eat a huge amount before you can
Okay.
see any impact.
So
Now,
eat your chicken, Charlene. You good. We're gonna
yeah,
eat our chicken and be all right.
go for it. Go for it.
Okay. Oh, I like this one. Kelly Miner says, she asked the question, are there any natural treatments for fibroids? I like that question. Okay.
That is an extremely, extremely good question. Thank you so
Mm-hmm.
much, Kelly, because I
Yes,
see
thank
this,
you.
I see that a lot in my practice. I've even seen patients who are paying monthly payments for all these natural, and herbal remedies and all that. But I'll tell you this, there's nothing that you're going to find in any books or any literature, scientific literature, that says that any supplement or any food or anything for that matter can actually help with the fibroids. This is a genetic issue. These are tumors. And, you know, if you, like we said, lifestyle changes, can help.
Okay.
But if you're contemplating buying any supplements or buying any herbal, remedies, all that, don't waste your money.
Okay.
Yeah.
Okay. So we can't black seed oil that one away. Okay.
Right.
um this question, keep that one up, Brian. I want to ask this one first. So for those women who desire to have children,
Mhm.
which treatment options can still maintain fertility as an option
Right.
as far
So-
as treating fibroids?
Right. So for years, the only thing we've offered patients who do have fibroids and they still wanna or desire future pregnancies was the myomectomy. Basically, for those who don't know what the myomectomy is the hysterectomy is the removal of the entire uterus and maybe the ovaries too. The myomectomy is when you leave the uterus in place, but you remove just the fibroids. And that
Okay.
usually is done, through conventional surgery and laparoscopy. But with the development of new technologies, especially the UFE, the embolization, we have realized that we can actually still maintain the fertility in patients without them having to undergo through conventional surgery. So the only two options to consider these days, if you are in childbearing age, you still desire future pregnancies, and you do have fibroids that are preventing you from getting pregnant or giving you or like causing you too many miscarriages, then consider either the myomectomy or the embolization. And
Okay.
sometimes we can do a combination of both. Both will maintain fertility, but obviously both will come with their risks, pros and cons and risks. So discuss that thoroughly with the physician you're going to go see about these issues. But
Okay.
definitely myomectomy and UFE will maintain your fertility.
Okay, got it. Thank you so much. So that kind of ties into this question right here
Mhm,
from Ebony McMorris. She said she was told since
mhm,
she's had a fibroid removed in her uterus, she wouldn't
mhm,
be able to have to have natural childbirth, only a
mhm,
C-section. She wants to know, is that true? And she said the reason they gave her was because the surgery usually leaves scarring that prohibits natural childbirth.
mhm, mhm,
So she's had a fibroid removed in her uterus.
mhm.
Is she able to have a natural childbirth, or does she have to have a C-section?
Most of the time, somebody who's had surgery for conventional surgery for fibroids like open surgery or laparoscopy, the wall of the uterus definitely is going to have scarring afterwards, and also there's going to be scarring around the uterus itself. So the uterus is not going to be moving the same way it would move if there was no surgery done before.
Mhm.
But most importantly, because the removal of the fibroids tends to leave a weakened wall, so the last thing you want is somebody getting pregnant and then they have a rupture of the uterus. That's a pretty life-threatening situation. So to be on the safe side, C-section is probably much safer than natural birth for somebody who's had especially heavy surgery on the uterus.
Okay.
Yeah.
Okay. Thank you for your question.
Last question, yes.
And I believe that you pretty much answered all the ones that we have. Was that all we got, Brian? So, for those who are just tuning in, I'm Ronnette Rollins from Praise 104.1. This is our very last heart to heart for the end of March, which is Women's History Month. So, this was for Women's Health Virtual Town Hall. And, baby, we got all up in our uterus, ladies. We talked all about it with Dr.
Right.
G of Image Guided Surgery. So, if you have any other questions, please do put them in the chat. You can also reach out to Dr. G. Now, Dr. G, tell the listeners and those watching how they can get in touch with you in your office.
Yes, definitely. So we are located in Clinton, Maryland, and we have a really large office, and we are basically the largest comprehensive fibroid center in the DMV. So all we do in our office is fibroids and adenomyosis and pelvic congestion syndrome. Our phone number is 240-244-2302. We do both educational consults and formal consults. And our website has basically simple language where you can find answers to all the questions relating, to women's health in general.
Okay.
That's metrofibroidcenter.com. And, I'll be happy to help anybody that, calls us or comes see us.
Thank you so much, Dr. G. Now, everyone, the information he just said is actually Oh, let me get my finger right. At the bottom of the screen. It's at the bottom of the screen on the ticker, the website, as well as the number. Dr. G from Image Guided Surgery. So thank you all so much for joining us. We appreciate you for taking the time. Please do like and share this on all of your social media because, listen, Dr. G answers some major questions about uterine fibroids, how to treat them. Some we do treat and some we don't. He talked about that. He talked about knowing your options, making sure that you go to the doctor armed with your information, your research that you do ahead of time, and then also asking your doctor all of the questions. Don't just take their first word as the last. Ask questions and also get second, third, fourth, fifth opinions,
Absolutely.
Yeah,
Yeah, be a good
absolutely.
advocate for yourself. It's important.
Be an advocate for yourself. I love that. So thank you all for joining us. And until next time, I'm Ronnette Rollins reminding you to keep God first in everything you do. Have an amazing night, everybody. Bye-bye.
Bye. Thank you.